Hello everyone, Dr. John Bartemus here today with my patient Brian, who would like to share his story of his journey through care with us. So Brian, thanks for doing this, and why did you first present to the office?
The first time I came in because of the severe back pain that I had and neck pain. I couldn't move my back or my neck. Honestly, when I first came in and you asked me to move for you, I moved my eyes up and down. I couldn't move left or right, up and down. I couldn't do anything.
Yeah, and the motion you see now is a vast improvement. So literally when he came in, I said, go through neck range of motion. He's like, that's it, you know. So right now, why don't you show us what you have? And viewers might be like,
yeah, you might not think it's a lot, but for somebody who hasn't moved in 3 years, I mean, to me, that's crazy.
And how much pain is that?
I don't have any pain.
And how much pain did you have when you came in?
I was always in pain, just constant pain.
Okay, low back and neck?
Low back and neck. So, you know, I mean, I was in pain for the last 20 years, honestly, with my lower back. And it's just progressed to me getting stiffer and stiffer until I just couldn't even move my neck. And that's when, you know, my wife kind of got tired of me complaining about the pain all the time, and I had to do something. We've seen numerous doctors, and I've taken all kinds of different pills and things like that, and gone to therapy, and really was just suggested to, the only thing we can do is we can operate on you, and I didn't want to do that.
Thankfully, because you mind sharing how old you are?
I'm 45.
45. So his last result before coming here, or last option, was to have surgery or stay on high-powered painkiller opioid drugs, which also, if you're watching the news, doesn't lead to positive outcomes. So he came here, and he mentioned that his pain started 20 years ago, and he's 45. And when he first presented, because of his lack of range of motion and some of the other things of his case, I had a suspicion that he may have an underlying inflammatory disease. So as we went through care, he improved, got the pain relief, got the improved range of motion, and then at one point in care, pain returned, especially in the back. What kind of pain did you get at that point?
It almost felt like somebody hit me in the back with a baseball bat, and it was just kind of in my kidney area, and everywhere else I didn't have pain, just in that one area, and that area was definitely a new pain. And you know, we went for more testing, and we kind of found out.
Yeah, so we went for testing there, and for those of you familiar with lab testing, he had a C-reactive protein initially of 15. This was before the back pain flared up. Then he had what felt like kidney stone pain, because he had kidney stones in the past. And so I ordered another test to look at C-reactive protein, and at that time it was 44. And so above 3 is bad. So we were worried and wanted to look. Basically, our differential was ultimately cancer or an inflammatory disease, and the suspicion that I had since I met him was that he had an inflammatory disease called Ankylosing Spondylitis. So we ran some genetic testing for genes that correlate with that disease. We had a CT scan of the abdomen and pelvis to rule out cancer, and then we tracked the C-reactive protein, and it ends up that he does have Ankylosing Spondylitis. So, you know, in learning that through the process, Brian, what pieces of the puzzle did that put together for you, or you know, what did you draw from that?
Once we started looking at that and kind of researching, and when I went back, and you know, I never heard of ankylosing spondylitis before, I started looking back and seeing, okay, lower back pain in your low to mid 20s, everything just fit me right up. And I mean, the frustrating thing was, as many doctors as I've seen, none of them have ever tested me for a C-reactive protein. None of them have ever tested me for anything else. And literally, and you maybe remember the first day I came in here, you sat down and talked to me, and we looked at my original lab results and my MRI and things like that. And I got mad, because you're the only one who explained to me what exactly was on there. And I said, man, I mean, okay, so I need to start coming to see you more, and just really learning about this and seeing everything. We put me on a special diet. With that special diet, I've lost weight. I've I've gained movement. Within 3 days, I was off of all of the pills that I was taking. You know, the anti-inflammatories and the opioids and everything like that, I stopped taking. And then probably about 3 weeks after that, I stopped taking omeprazole because I had constant heartburn, and probably because of all the pills and everything I was taking as well. Mm-hmm. So, you know, I take a couple of things like fish oil and turmeric, and you know, I'm taking spices. I'm replacing pills with essentially spices, and changing my food and my lifestyle. And it's just been a crazy difference in these few short months.
Yeah, and he's done a great job, and you know, for people out there, we don't want them to get the wrong idea. So was this hard or easy?
It was definitely hard. You know, especially the diet change and everything like that. When you start thinking of the things that, what causes inflammation and everything like that, and you're told, hey, you can't have this. And to me, it's the basic things that I was having. You know, the first 3 or 4 weeks of that was not easy at all. And it really is a lifestyle change. And you know, I've learned a lot, and I've learned that now what I've got to do is I've got to maintain that lifestyle change, and I've got to exercise and just treat what I have. And I mean, it's incredible the difference and the outlook that I have, and I really appreciate it.
Yeah, it's my pleasure. And what he understands is something like ankylosing spondylitis, you're not necessarily going to heal, but you can minimize the flare so that you can live a normal life if you're doing the proper lifestyle choices that he has adopted. And so I'd ask one more question here before we go, but we did say it is hard, you know, it takes hard work, but you know, compared to maybe not being able to eat the things you used to love versus being out of the pain that you had to live in, it's a no-brainer, right?
Absolutely. Okay. Yes. I mean, yeah, I say it's hard because I can't have an ice cream, you know. Of course, now there's different kind of ice creams I can have. Things like that. I mean, it's just relearning, and that's all that is. And now I don't even think about it. It's just basics, and it's been great.
Awesome. Well, Brian, thank you.
Thank you.
I'm Dr. John Bartemus, and this is my passion. This is what I live to do, and you'll see my hashtag slogan is Life at Optimal, and this is what I love to do, is help people like you and like Brian achieve a life at optimal. Have a great day.